So again, my name is Ian Costello, and I am a senior program manager at the Corporation for Supportive Housing. We're a national nonprofit. We do a number of things, including training and technical assistance, and I am located in Los Angeles, California. I wanted to talk to you about the frequent user systems engagement project, initiative, approach. It's kind of all of those things. And I definitely want to emphasize the plurals on both users and systems. It's people that are cycling through many, many systems. Sorry, I'm ahead of myself here. So who are frequent users? And I understand that you'll have a copy of these slides sent to you or available at some point. So don't worry about having to take notes or screenshots or something like that. So I just wanted to talk about who are frequent users, just to provide you with a one definition. They're people who have periods of institutional involvement. They're cycling through systems. As part of the sort of more wonky specifics around homeless services, they often lack what's called chronicity or chronic homeless status. And to be chronic homeless, that is a federal definition that's connected to a lot of resources, a lot of eligibility criteria, particularly around permanent supportive housing that is funded through specific federal funding streams, require people to be chronic. But if you're cycling through systems, you don't have one of the key elements, which is time. So you need to have a continuous experience of homelessness, of unsheltered homelessness, to be considered chronic, to then be considered for the kind of deep resources and subsidies that the mainstream homeless response system is sort of used to. So we certainly recognize frequent users and systems involvement as a gap in sort of the mainstream services. And that's a policy decision. Like any other, there's consequences to it. There's costs and drawbacks to it. So it's not that it's good or bad. It's just that's the policy decision that was put in place, and sort of we're meant to understand where the gaps are and try to plug them as best as we can. And Les mentioned earlier, I don't remember if it was in the main room or in our room, but was talking about the data that you already have, understanding either through research or anecdote that our community is engaging with people who are experiencing homelessness and who are going through jail and who are potentially going through the healthcare system and the juvenile justice system and the foster care system. So you kind of have these hypotheses that come up that, like, in our community, we know that there's a lot of crossover. We've done research, or we know it through anecdote, and that's something that is just understood. So what do we do with that? Other communities have the inverse of that, where maybe people are not sure or don't know, or are sure that they don't have a lot of crossover, that people just sort of stay in their lane and that's how it goes. I don't know that that's more rare that we experience that, but just sort of laying out how communities approach the idea of multiple system involvement. And so Fuse is a collection, is an approach, and it's a collection of steps. It's laid out this way with 3 phases: planning, implementation, and scaling, and these 10 nice, neat steps. Of course, we know that any project or any approach, especially when working in the systems in which we work, is not going to be as linear or clean. But I lay these out as milestones on how you would develop a successful Fuse program. And I would go so far as to say that Fuse isn't really Fuse without these. And so they're really major key elements that really need to be developed fully to be called Fuse in the truest sense. My background is in data and analytics, and so I am focusing primarily on step 3, which is executing a data match. And so I'm going to talk a little bit about that. And I think for me, that's really where the rubber meets the road, and you can begin to combine both the quantitative just learning today about collecting information regarding police interactions. I think that's really fabulous. There's other data sources that exist in the community that you can also leverage and match on a person and identifiable way to dig in and analyze the extent of systems interaction, the characteristics of it, and also the outcomes and results, as you know, both in terms of gaps and consequences. So I would like you to picture, just in your mind and on the screen, a period of 2 years and one person's experience through those 2 years. That person may go into hospital and spend some time in hospital and have, in this case, 4 instances of a hospital stay. And this is what the hospital would see. They see one patient staying in the hospital 2 times per year, 4 times over the course of 2 years. A jail may see this for that same person. They may see the jail involvement, a few bookings, 3 bookings over the course of 2 years. And for that same person, the homeless system may see this experience of homelessness through the 2-year period. Separately, they seem isolated and not as intense maybe. But through a data match, you can begin to understand when you pull those pieces together and stitch them on an individual level, you can really understand how the systems work, or in this case don't work together, that there are significant gaps, and that it's not someone going from homelessness to somewhere else or to an unknown destination, but by doing a data match you can really you can then say that no, this person went from an experience of homelessness to jail, and they went from jail directly into the hospital, and they went from a hospital back into homelessness. And I think you can, in the aggregate, draw some really interesting conclusions, and hopefully build the case, not only the case for Fuse, but also then prepare the kind of partnerships that you may need. So in doing an analysis like this, you may discover that, wow, a lot of people that are cycling through our systems also have a severe mental health diagnosis. So where's behavioral health? Are they at the table? How can we strengthen that kind of partnership? So that just as an example of the kinds of things that you may learn. And then going from the match, where you understand what are the different systems in your community, how can we pull data together? When you get all of that data together and matched, I think the next logical step is doing a population analysis. And this is just one example, a very concise example from another community. And they, not to go into too many details, but they were able to match everything in-house. So this is at the state level. They had all the state Medicaid information, they had all the corrections information, as well as the homeless system information. It was a statewide continuum of care. And so they had everything in-house. They were able to match it on a person level and then provide us with the results. And some just quick takeaways here. Is that of the people that had systems involvement, we're looking at a total of 5,800 people. So there are 5,800 people that are represented in this in these graphs, and of those, 63, you can see the systems involvement here: health only, homelessness and health, jail and health, and then all 3 systems here: jail, homelessness, and health. And so from that 5,800 people, it was reduced to 63 that experienced all 3 systems involvement: jail, homelessness, and health. And then you're able to pull out additional elements of what that interaction looked like. So how many average jail bed days did these populations have? How many inpatient emergency department days did these people in the different categories have? And then also average Medicaid costs and total Medicaid costs. So just like a very quick picture of like, what does system involvement look like, and how does it differ when you're layering on additional systems? And just one takeaway that I find really interesting and sort of indicative of what of the story of multiple systems involvement is looking at the jail and health and the jail, homelessness, and health population and the average bed days. So the folks that are in jail and health had an average bed day that in jail, that means they stayed in jail an average of 31 days. If you tack on an experience of homelessness, it actually goes down from 31 to 24. And it's not necessarily that the average days are fewer. Like when you look at individuals, it may the distribution may look fairly similar, but because they're also experiencing homelessness, they spend time elsewhere. So they don't spend, because they're not spending time in jail, they're spending time in experiencing homelessness on shelter on the street. But just kind of looking at it as like, oh, it's reduced, isn't that better? Kind of, but you have to kind of take the whole picture into account, and you can only do that when you are able to combine the data and see everything laid out against itself. So I really think that this is a very, this is sort of how you can take data, match it together, begin to understand something about the population, and then also begin to serve folks. So for this community, they went from 5,800 people down to 63, and they said, great, that's our population, that's who we're going to go serve. And so going to then to unmask those 63 records and saying, okay, the first person on our list is Joe Smith. Where is Joe Smith? Doing a case conferencing to figure out where folks were, and then provide them with the resources that they need. And through that, they were able to learn a lot about their system and their system connections. And so in addition to just housing folks, they're also able to create systems change. So the experience of housing Joe Smith led to understanding how the jail discharges folks, and what kind of policies they need to put in place to benefit not only the Fuse participants, but also everyone else. And so it's not only about housing folks, it's about creating systems change and political will to do better and to create systems that work for everyone. Some quick things about like what to share and how to get started. I think for matching, one of the biggest stumbling blocks for Fuse is you have to identify your information. It has to be shared, and you can do that appropriately and legally with paperwork. But it's important to just call that out immediately, that you need to share at a minimum Social Security numbers, first name, last name, and date of birth. You can do that. You can do that legally and the right way. It takes time to do that, but I just want to say that that's how you share data. There's some ways to do this quickly and show value. You can do this as what's called a list of lists approach. So if the homeless response system, the jail, police know who their frequent users are, you can put those folks on a list, either top 10 or top 50 or top 100, and then come together as one group and say, okay, Joe Smith's on my list. Is Joe Smith on your list? Yeah. Okay. How do you rank? What's the intensity of that person's service, and get an idea, kind of a sample of how you can move toward a full match. There's a lot of approaches to data sharing, and they may not always fit with the community, either the technical capacity of the community or the goals, and that's okay. But there's a number of ways to do it. I think in this case, it seems like you'd want to drive toward a one-time match to just pull one set of data from each of the different systems to match together. And if that works, then maybe doing that again and making it a repeated process, going all the way back, all the way down to a real-time data exchange with which other communities do have. And there are examples out there for that. I want to just call out that there are, like I was saying in the beginning, that there are some steps to Fuse that without which wouldn't be Fuse. The core elements of Fuse, which are non-negotiable, the first one is supportive housing. So Fuse is done with permanent housing that's not time limited and has wraparound services. The next thing is data. You can't have Fuse without matching data. Hopefully that's pretty clear. And then there are two other elements that are non-negotiables. with Infuse. And the first one is including people with lived experience in the design and decision making of the program. It should be a compensated experience. This is a career for me. It's a job for me. So to impart your experience of your lived experience of a system is important to also honor that monetarily, just as we get paid to go to meetings as well. And then the last element, which is important to consider, is to be racially explicit and to incorporate racial equity practices into the program. That's both in program implementation, but also in data analysis. And at a minimum, it's collecting information based on demographics, analyzing disparities and disproportionality, understanding access and outcome, and also the same thing is incorporating people with these experiences and perspectives into the decision making and development of these programs. And there's a lot of resources out there. A lot of communities do that, and there's just a whole host of experience to draw from. And so, in moving from program design into financing, there's many communities do it differently, and there's not a one-size-fits-all approach. It does depend on the resources that are available and the political context and environment that each community is situated in terms of how you finance things. So these are just some examples of how you finance the two main components around housing and then the supportive services. These are the common elements that we see. There are some more creative ways to go about it. A local tax, I think, might have been mentioned earlier in the conversation. That's certainly one of them. Flexible housing pools is another option, and I can put some resources in the chat around what those are. But in essence, it's a public-private partnership, often where either county departments, managed care organizations pool their resources, and then from that pool, members of those constituent groups are housed and provided services. The theory being that, hey, if you provide them housing up front, they're probably not going to cost as much on the back end because they're not using the emergency services that cost a lot. They're being provided with housing and preventative care and appropriate care. And then the third thing is around impact investment. Some call it pay for success. There's a lot of examples out there. Some of the bigger ones in Los Angeles, where I live, there's something called a Just and Reach project that just wrapped up. And then another one that's getting a lot of attention is the Denver Social Impact Bond. And I'll put some of the resources around that in the chat as well. Supportive services are really important. I was very glad to hear the conversation around the Medicaid waiver earlier. I think that's a really great thing to be involved in and work toward. Living in California, I get to hear a lot about CalAIM, which is part of the waiver experience. It's called Advancing and Innovating Medicaid, which is the AIM part. And Medicaid offsets are certainly part of the bargain here. And there's a lot of different and innovative practices that are going on with that that are connecting housing providers with the ability to bill to Medicaid, to do housing navigation. The state's also providing a lot of incentives to Medicaid, to managed care plans to provide housing partners with technology and the know-how to bill appropriately and also improve their data capture so that it can be much better quality and meet a lot of the standards that Medicaid lays out. So I think that's a really good thing to keep on your radar because it could be a good source of funding ongoing for particularly services, which I find are some of the harder pieces to fill in the budget. So with that, I hope I'm not over time. I wanted to kind of blaze through this as fast as I could to get to questions and discussion. So I'll leave it there. Are there any questions or comments?
Thanks so much, Ian. I really appreciate that presentation. This is an incredible model, and I like the flexibility to adapt it to local contexts wherever we take it. So really appreciate that's a lot. I know it's a lot more complex and technical, but that was a great overview. Let me ask a 10-foot level question that, and sorry for my ignorance, but back to the slide which was showing the different percentage breakdown of users based on the parts of the system from jail to homelessness to health, and so forth. Was I understanding that this was pre-intervention? This was a way to identify frequent users that were going through, like, for example, the 63 went through jail, homelessness, and health.
Correct.
Okay, so, and if so, if we're just, because when I see that, I see that's only 1% of the population, which I have to say is very surprising to me that only 1% would be using all three, just from our anecdotal experience. So I want to make sure I was understanding that right. And then if so, are we only targeting that 1%? Ultimately, how much of an impact can you have systematically?
Yeah, good question. So just to be clear, this is another community. So this is not your community's data. This is from another state, very small state. And the parameter, I don't remember the specific parameters around these data, so they may have limited it in a way that maybe doesn't pull in other folks. So just putting some caveats down around that. And then thinking about how you make an impact. So this is a really small community. They had very little funding. So to go from 58 people to 63 allowed them to think in a way strategically about how are we going to house these folks, and then from that, what are we going to learn about that process to then amend, develop, strengthen, or get rid of the policies that are preventing us from housing these folks quickly. So what about these 63 folks' experiences through systems are we also learning, in addition to providing them with the resources that they need now? What do we learn about when Joe Smith came out of jail? What was that experience like? How or why were they not putting, how or why wasn't the jail connecting with the housing system up front, and allowing the person to fall into homelessness, and then the person didn't engage in homelessness and came back to jail or went into hospital? So just like, I think it's twofold. It's providing services and resources to individuals now who need them, and also through that understanding their experiences, histories, and how does that relate to systems improvement or policy improvement or systems change that we may want to implement, whether that's a legal thing that you have to change legislation, or it's a policy thing or a programmatic thing that maybe is quicker to change. I hope that was responsive to the question.
Yeah, no, it makes sense. Just one quick follow-up is on the health only line. These folks obviously are not homeless necessarily. The 5,100, they're not homeless. They haven't been to jail. And so who are these? Who are these folks that are under the health only line? Are they low income? What does that mean?
Yeah, those are Medicaid participants.
Oh, okay, got it. Yep. Got it.
And another more comprehensive analysis I put into the chat that we helped with a report in Multnomah County, which is Portland, Oregon. It's not a terribly lengthy read, but it's really, really interesting and gets into how the analysis was done in this community, what the data systems were, and also what was found. And I think the takeaway from it is that supportive housing it was a game changer. It reduced a lot of the negative impacts of all of the different systems, which led, and they did kind of they were able to do a comparative study, not necessarily with Fuse being the change, but with housing being the change. So they looked at people that got permanent supportive housing and maintained it for a year, and people who did not, and then comparing the outcomes between those populations. It's a really, really good report, and I encourage you to read it.
Absolutely, will do. And do you differentiate within supportive housing different types of supportive housing?
Good question. Do you mean like,
for example,
scattered site?
Focused on re-entry type needs versus other needs? Because there's it seems to me that like a housing first model is generally great because of its flexibility, but for example, someone who's looking to avoid an environment where there might be drug use going on or so forth, like more clean and sober housing as a form of supportive housing.
I'm not sure. I don't know the answer to that. I would also say that it's there's a lot wrapped up in supportive housing and things like clean and sober housing, where the support where it could be time limited, in which case, it may not be considered PSH, and also around the requirement for services. I'm not the expert in that, but I know that there's a lot there. So I really can't answer definitively.
Great.
I would also say, though, that there's a resource in there around the Just and Reach project, which was part of the Office of Diversion and Reentry as part of Los Angeles County. And that was a pay for success program that worked with people coming straight from jail that had to go through the courts and have an agreement with the prosecuting attorney to sort of provide them with PSH, and had a lot of the elements that you're talking about wrapped up in them, where you have to have urinalysis test done and all that stuff, and sort of working with the judges to allow that. I think there was actually a special courtroom that was established, and the judge had a little bit more context and education around the population, what the program was trying to achieve.
Great, thanks so much.
Oh, and I'm sorry, I would be remiss if I didn't share one more thing. If you just give me just one more second here. But I just want to plug really quickly our summit. CSH has a summit, and this year we're going to be in Philadelphia at the end of May and the beginning of June, and early registration is open now. I think it's a really bias, of course, but it's a really great opportunity to learn more about supportive housing, development, and the intersections of different systems. Great, thank you so much.
Thank you so much, Ian. I'm taking a lot of notes too. And some of the questions actually you answered already from Liam. One of the things I was wondering about was how does this specifically work with the courts? And you answered that. There can be specialty courts with this. And also the housing first model. I guess we all kind of wonder about that, because how does that fit together, especially with the population we work with? Has this, I have a question. There's seems to be some similarities to LEAD. I think Dan pointed out. Is this sort of a LEAD model? Is this similar to one, or what's the differences?
And that's the law enforcement
assisted diversion. Yes.
Yeah. I think they can be a potential partner, a data source, and a referral source. So in listening to law enforcement colleagues today just talking about the interactions, what it got me thinking of is allowing Fuse to also be a way that that officers have a way to have a place to go, right? Like I think you can interact with people, but and same thing I think within health, and doctors may engage with people who are experiencing homelessness all the time, but they can fix broken legs, they can restart hearts, but they can't house anyone, and so they're sort of left without the resources or experience to do that. And so I think what Fuse can do is pull these different systems together to say, we do housing, we can provide resources and services. Here's a conduit that you can come to when you engage with someone to do diversion. You have an outlet for that. And also in Portland and Multnomah County, we're working with them on a Fuse project right now, and they have also a lead model and a HOPE team in their I think in the sheriff's department, which is really, really great. So it's definitely hand in glove.
Thank you. And it really comes down to what we all are working on is enough housing, really a place. And I hear this from police department. I hear this from the courts. I hear this from probation officers, and everyone is looking at, of course, a place. And having these places is not the easiest thing to come by, especially in smaller communities. There's not a lot of available except for other landlords, and those when you have housing that is from a private landlord, that raises the cost significantly, rather than having a repurposed property from either the county or the state, which we don't have much of here in Big Island. So again, thank you so much for the presentation. You have your